Gout. What the hell is gout? Gout is an inflammatory joint condition that progresses in painful attacks and can over time lead to chronic complications. This disorder is directly related to a disturbance in purine metabolism, resulting in excessive accumulation of uric acid in the blood. That's what we called hyperuricemia. Hyper meaning elevated, uricemia meaning uric acid in the blood. It is predominantly male condition, affecting about 90% of young men. In absence of treatment, the crystals continue to accumulate in the joints, leading to chronic gout. Beyond joint pain, gout can have severe consequences on mobility and joint function, affecting patients' quality of life. Moreover, in cases of advanced kidney involvement, it can compromise life expectancy, so be careful. When it comes to the pathophysiology of gout, we will talk about two mechanisms: the mechanism of hyperuricemia and the mechanism of gout attack. Let's start with the hyperuricemia. Gout can result from an excessive accumulation of uric acid in the blood, as we said before, which can stem from two main processes. It can be caused by an excessive increase in uric acid production, which can result from excessive synthesis of purine, often linked to a deficiency in some enzymes, or can be linked to an increased breakdown of endogenous nucleic acids, like in the case of massive cell destruction or what we call cell lysis, like in certain hematologic disease or during chemotherapy. This excessive increase in uric acid can also result from excessive dietary intake resulting from an overconsumption of foods rich in nucleic acids, like red meats, organ meats, seafood, alcohol, etc. These products or these foods increases uric acid production. The second process is a defect in uric acid elimination. So any defect can increase uric acid in the blood, and this defect can be caused by renal insufficiency, which reduces the elimination of uric acid, thereby promoting its accumulation, or it can be caused by medications that reduce urinary excretion. Now let's talk about the mechanism of gout attack. Well, gout attacks typically occur suddenly and are extremely painful. They result from an inflammatory reaction caused by the presence of sodium urate crystals in the joint. A gout attack can be triggered by the rupture of pre-existing urate deposit within the joint, or by a rapid increase in blood uric acid levels. This sudden release of sodium urate crystals into the synovial fluid triggers an intense inflammatory response responsible for the acute arteritis that characterize a gout flare. Macrophages in the synovial membrane recognize these crystals as foreign agents and attempt to eliminate them through a phenomenon called phagocytosis. This process leads to the release of inflammatory cytokines, which attract neutrophils into the joint. This inflammatory cascade amplifies the response and causes the typical symptoms of the flare: intense pain, redness, warmth, and swelling of the affected joint. Now, what are the etiologies of gout? Gout is a metabolic disease that can have either primary or secondary origin. Primary gout accounts for about 90% of cases and results from a genetic predisposition combined with environmental factors. In the majority of cases, the exact cause of primary gout remains unknown. It mainly affects middle-aged men, often overweight and consuming a purine-rich diet, like we said before, red meats, seafood, alcohol, etc. Some forms of primary gout are linked to enzymatic mutations affecting purine metabolism, while secondary gout is less common than the primary form and results from identifiable causes, whether it's increased uric acid production or decreased renal elimination. First cause of secondary gout is chronic kidney disease. When the kidneys are no longer functioning properly, uric acid elimination is reduced, promoting its accumulation in the blood. A hematological disorder, like certain blood disease like leukemia or myeloproliferative syndromes, can cause a massive destruction of blood cells, releasing a large amounts of nucleic acids, and their excessive metabolism then leads to hyperuricemia. Psoriasis is a chronic inflammatory skin disease that accelerates cell turnover. This rapid destruction of skin cells leads to excessive uric acid production, increasing the risk of gout. Another rare cause is high blood pressure during pregnancy, which can impair kidney function, promoting secondary hyperuricemia. Hypothyroidism, which is a deficiency in thyroid hormones, slows down many metabolic processes, including renal elimination of uric acid, which can lead to hyperuricemia and increase the risk of developing gout. Finally, drug-induced or iatrogenic origin, especially diuretics, which increase uric acid reabsorption in the kidney. Low dose of aspirin urine, chemotherapy which causes massive cellular destruction and releases a large amount of nucleic acids, and cyclosporine, which is an immunosuppressant commonly used in organ transplantation, which can impair kidney function and promote hyperuricemia. We will talk about positive diagnosis, clinical symptoms and details, and the treatment for this disease. Thank you so much for watching until the end, and if you have any question, no matter what, just write it below. Thank you so much, and I'll see you in the next one. Bye bye.